Test 1 2 3. Test 3 2 1.
We will be live in 3, 2, and 1.
Good morning, everyone. Welcome to the Tarrant County Hospital District Finance Committee, the Board of Managers. We will begin today with, let me pull up my schedule. Any citizens wishing to address the committee this morning? Assuming that means no, we'll move to item 3, approval of the minutes from the April 22nd meeting. I'll entertain a motion to approve those minutes.
This is Dorothy. Move approval of the minutes.
Motion by Mr. Bose. Do I hear a second?
This is Trent, second.
Second by Mr. Petty. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, everyone. Item 4, CFO report. Ms. Clark. Floor is yours.
Thank you. I would like to introduce someone this morning. Tony Banda joined us about 4 weeks ago as the Vice President of Finance and Supply Chain. We are very glad to have him here. Tony grew up in public accounting with PricewaterhouseCoopers. Most recently, he was the CFO at Franciscan Health in Chicago, and he also worked at Cook County in Chicago. So he comes with some great public hospital experience, and I'd like to give Tony just a moment to tell you a little bit about himself.
Well, thank you, Sharon, and good morning, everyone.
Good morning.
Very grateful to come aboard. It's a storied organization, and I just have 30 years of healthcare experience that I just wish to bring on board and help in whatever way I can to move the organization forward. So thank you. Thank you for having me. I look forward to it.
Thank you, Tony. Pleasure to meet you. And I've heard great things about you, and I'm looking forward to your contributions to this great organization. Thank you for being here.
So this committee will be seeing a lot more of Tony as he gets his feet on the ground here. And again, I'm very excited to have him here. So that's really the only thing I wanted to do today in my CFO report.
Okay. Any questions for Tony or Sharon? Okay, we'll move to item 5, which is matters that require discussion or committee action. Item 5A is the consider acceptance of the April 2021 unaudited financial report. Ms. Clark.
So if we could flip to the next slide, one more slide. Here we go. You know, I've got to say that we have been very consistent the last few months. We've seen not quite budgeted volumes most of this year. We had budgeted, you know, you remember a year ago we talked about hopefully seeing a slow recovery towards our volumes pre-COVID. That's not quite happened in a lot of our areas, but this month is very consistent and on trend with prior months with volume. You can see admissions and patient days were very close to March. And our case mix index is trending downward, beginning to level off, which is also lowering our length of stay. So both of those are, in my mind, good trends to be having. Our length of stay had kind of reached an all-time high back in January and February. So we are starting to see that normalize. Next slide, please. Our emergency department, again, volumes consistent with the prior months, as well as urgent care. When you look to the right side of this page, we have primary and specialty care visits. Our primary care visits, although that little box is yellow, it was actually right on target. We were less than 0.5% lower. And this month, we've got about 30% of that volume being telehealth. In the specialty clinics, we remain above budget by about 19% this month. And we've got about 28% of those being telehealth visits. Next slide. Invasive labs is right on budget. It's about 1% under. And then our inpatient surgeries were a little bit lower than trend and a little bit lower than budget this month. We were about 76 cases behind. But year to date, we are actually right on track for the inpatient surgeries. Our outpatient surgeries are much stronger this month. As you can see, we're about 28% ahead of our budget and quite a bit higher than March. Year to date, we have had about a 14% overage in the outpatient surgeries. So that volume has recovered. Our next slide is really focused around mental health. Again, psych patient days right on budget. Our clinic visits were slightly under by about 2%. The emergency visits are above by about 8%, our budget projection. And outside medical services remains a little bit high, but that tends to fluctuate from month to month. Next slide, please. So some of our financial metrics, our days cash on hand, will begin to level off for a couple of reasons. If you recall, during the beginning of COVID, kind of right there in the April timeframe, we were able to get a Medicare advance payment. That advance payment is starting to begin to get repaid. So that's one driver. And then the other is just our normal utilization of cash as we got a big chunk of our money in January and February from property tax revenue. Our net AR days remain pretty consistent at about 41 days. And you can see at the bottom right, our FTEs per adjusted patient day are lower at 6.01 than last year, but we're still a little bit unfavorable to the 21 budget. Next slide, please. Our connection enrollment increased about 3%. We talked about in March how we had given quite a few extensions throughout COVID. And then in March, we had a lot of people reapply. Some of them did not. So what you're seeing this month is that actual recovery of kind of our normal increase in signups. If you could skip 2 slides to the income statement. We had a strong financial month again. Most of it's related to the top side of the income statement and our net patient service revenue. We have favorable payer mixes. We did budget for kind of a decline in our payer mix, an increase of self-pay. That has not materialized this year. So that has a favorable impact to that line item. We also have additional payments related to the higher CMI that we talked about on the first page of graphs. And we have additional Medicare UC this year as well. So all of that sets us up nicely. Even in the operating expenses, we have come in slightly under budget in those operating expenses. So we closed the month at $17.5 million. If you look year to date, we are about $41 million ahead of budget when you look at the income from operations. Just as a reminder, we have about $18 million that we have identified that was not budgeted. We've gone over that the last few months. as well as about 8 million of capital. And there is some timing in those year-to-date numbers. Some of the projects in the purchase service line item have been delayed slightly, and those will likely catch up by the end of the year. And, you know, we footnoted this at the bottom of the page, but that excess also will allow us to start to accelerate payment for some of the bond program initiatives. On the next two slides from the unbudgeted operating and unbudgeted capital, there's not been any changes from last month, so I didn't really plan to cover these in any level of detail. So if you can flip the slides to the next set of graphs, which I think is about 5 pages back. There we go. Were there any questions on the medical center before I start to talk about a claim? Okay. On a claim, you can see that we had a favorable build encounters. They were about 1% above budget for this month, as well as about 3% ahead year to date. And then our net operating expense per encounter at the bottom right of the page is favorable both for the month, and it's about 6% favorable for the 7 months ended April. If you can flip to the income statement 2 pages back. So for April, you know, a claim had another favorable month. They ended the month at about 1.3 million ahead of their budget, which brings them year to date favorable to their budget by about 6.7 million. A lot of this is made up on the top side of the income statement, again, in net patient service revenue and our collection efforts around that. We've also experienced a higher charge per encounter based on a little bit heavier weight in specialties than in the primary care areas. And then we've also been able to achieve some expense savings this year. Year to date, that's at about 3.4 million. Over half of that is in salary and benefits. So if you flip to the next slide, this kind of pulls both operating companies together, hospital, a claim, as well as some foundation activity. And year to date, kind of on that, about 2/3 of the way down, we have our income from operations at 110.7 for the medical center, an investment in 22.8 for a claim, for a total of 88.6, which puts us ahead of the budget of 40.5 million. Are there any questions on April?
It's pretty significant. Any questions for Sharon? Sharon, that one item on the foundation, look, the foundation's way outperforming its budget. Is there anything in particular that is driving that?
You know, they've had some additional grants and donations come their way. A portion of it could be some timing as well. It's pretty difficult to budget too specifically for the foundation. We just kind of look and see what came in last year, and we do our best to project that. But they have had a good year.
Okay, thank you.
You bet.
Okay, any other questions for Sharon? Is that your concluding your report, Sharon?
It is, thank you.
Okay. If there are no other questions, I'd like to consider a motion to accept the April 2021 report. Entertain a motion.
Move approval.
Motion by DT Nguyen.
Second.
Second by Dorothy DeBose. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Motion passes. Thank you all. Ms. Clark, item 5B.
So I have a policy it has not really any substantive updates, although there is some red lines on here. This was an older policy that we tried to simplify. This is a selection of a depository, our banking institution that does most of our transactions. Currently, that is Chase. We are able to gain favorable pricing, just as a reminder, from Chase based on the county's contract. So it's kind of a efficiencies of scale on that one. The major changes to this is we did remove some language for exceptions. It's implied that.
Sharon, if I can interrupt you for a second.
Yes.
Jeff, could you show that slide? Or is there?
Page 37 of the book. I don't know. I didn't really prepare a slide for this.
Okay,
I apologize, but I am
sure.
on page 37 of your
Okay,
book.
make sure everybody had a view of that. Thank you.
You bet. I did omit the exception to policy. It's always implied that the executives, the CEO, the CFO could bring to the board and request an exception. And there was some language regarding some Texas state law that was no longer applicable that was removed.
Okay. Any questions for Sharon? But substantively, it's not changed. It's just simplified somewhat, but substantively changed.
Yeah, we just really updated it for current language.
Right. Any questions for Sharon on that item? You guys are easy this morning. Okay, I'll entertain a motion on item 5B.
So moved.
Second.
Motion by Mr. Petty, a second by Mr. Nguyen. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, everyone. Thank you, Sharon. We'll move to item C, Rory. It sounds like you should say your name, Roy McCready. Rory, you're up.
Roy Clark, Rory McCready, whatever, Mr. Chairman, that'll work. I'm kind of like David, whatever you want to call me. So, item number C relates to a company called Immodal. They provide speech recognition technology. It's called Fluency Direct. It converts speech to text. We are asking for an extension or a contract of 14 months. The request for exception relates to the fact that Immodal was purchased by 3M. And if we were to RFP Immodal currently this spring, we'd have to turn around and RFP it again next spring. So it doesn't really make sense to have to do an RFP, expend resources on that, and then turn around and do it again as a consolidated effort with 3M next spring. So I'll take questions on item number C.
So we're just getting these contracts to coincide. So when we do re-RFP or rebid or whenever or renew, they'll be in line, right?
That is correct. Perfect explanation.
See, Robert, perfect. He said the word perfect, Robert. Did you hear that?
Well, this is DT. A question for you is more of where do you define the application that goes to finance for approval? Which one goes to IT for approval?
That's a great question. This is just one of those contracts that really, the support for 3M is really managed more in IT right now, and the resources there to support it. Immodal is actually supported through some dedicated resources within HIM. That's the logic behind finance or revenue cycle HIM having this contract versus IT. It's a good question you ask, and I actually had to ask that question in preparation for the meeting today. I hope that answers your question. It revolves around support is the short answer.
It does. Thank you.
Yes, sir.
Trent, did you have a question for Rory?
I did not. I'm sorry.
Oh, I thought you were looking like you did.
Nope.
Okay, you've heard the explanation, and any other questions for Rory? This is needs to be a two-part motion for the exception to bid and the motion itself. So I'll entertain such a motion.
Move for approval along with the exception to the bidding process.
Second.
Thank you, DT. We have a motion by Mr. Nguyen, a second by Mr. Petty. All in favor of the motion, please say aye.
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 Opposed? Motion passes. Thank you, everyone. Item D, Rory.
All right, item D relates to a company called TransUnion. TransUnion is in the business of providing JPS coverage identification. As you know, we have a very large uninsured population, and TransUnion uses technology to search for insurance on patients that we might not know about. A couple of common reasons would be a patient applies for Medicaid, and we don't know they applied for Medicaid and actually got approved. And then we would also have issues where we would have a coverage loaded that might just have a member number that's wrong or a quality error. And so they would detect that and report that back to us so we could correct the billing. It's about $821,000 annually, but it does have about a 5-to-1 return, which would translate to about $4 to $5 million in reimbursement to JPS per year. So we would take questions now on that item.
Rory, is that a fixed fee or is that like a percentage of, I guess they don't do recovery. They just help identify payers.
Yeah, so we've been under a percentage recovery contract for the last 3 years. This year we did do a fixed fee because they had a cap and we were always hitting the cap. So we actually saved $40,000 this year by moving to a fixed fee arrangement. Of course, we would reevaluate that if we began to have less spend than the cap. So good question.
Okay.
Roy, is there a chance that, because most of this work sometimes can be crossover between your Medicaid eligibility company, but they hit a certain time that it flip over to the other side for scanning. Is there a chance that we can overlap and pay double the fee because the other one's still claiming it?
We should not be, if there is what we do is direct reconcile those items, DT. We actually should be paying the eligibility company the fee, and if it's detected by them and reported to us, then we should only pay one. We should not pay TransUnion as well, and we do reconcile that. And if TransUnion happens to bill us for those, then we'll report that back to them so that we're not being double dipped, if you will.
Right. It is the old eScan that they acquire division.
It is the former eScan. That is the company that was purchased by TransUnion.
Got it. Okay. Thank you.
Yes, sir.
Okay, any other questions for Rory? Hearing none, I'll entertain a motion on item 5D.
Move for approval.
Motion by Mr. Nguyen.
Second.
Second. I'm sorry. Who was it? Is that Dr. Hurd?
No, that was Amanda.
Oh, Amanda. Thank you. I didn't see you, Amanda. Thank you. Second by Ms. Arizola. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, everyone. Douglas Chung, item E, the floor is yours.
Thank you. So item E is a third amendment with Secyrus. We use them to purchase our annual flu vaccine allotment every year. And this is the time of year where we make that commitment. It's for one time this year, $745,000 in flu vaccine. This is part of the Vizient GPO as well, and we get discounts through them. And so, and this obviously something that we have to do every year. So any questions on that?
Any questions for Doug?
Doug, just curious, what was your utilization of that vaccine this year compared to prior years?
I don't have that. I know we give about, any given year, about 45,000 or so doses of flu vaccine on a given year, but that's something I can follow up with you. I don't have that number for you right now, but I'll definitely get that.
I've just heard that there was a dramatic reduction in flu vaccine and flu as a result of COVID, and I just didn't know if we had any statistics on it.
There's absolutely a dramatic reduction in actual flu disease right through our public health efforts that we've seen here. But I can definitely follow up with you as far as utilization of the vaccine.
Is the flu vaccine something that we get reimbursed for through Medicare, Medicaid, or any other reimbursement source?
It is.
Okay.
Steve, I have a question.
Yes, ma'am.
Not on the information presented, but on your diversity form that we have included. I don't know if anyone is from the vendor. In all that information they give us on their policy, they tell us our diversity and inclusion objective and targets are disclosed in our annual report. Do anybody know what that is? Since they bothered to put it in here, I was just asking if the vendor, whoever do this report, if they know what that is.
I apologize, Mr. I don't have that on me right now, but again, I get happy to follow up with you as well.
All right. Okay.
Okay. Further questions for Doug? Hearing none, I'll entertain a motion on item 5E. No, I'm sorry. Yeah, 5E.
This is Dorothy. Move approval.
Motion by Mr. Bose.
Second.
Second by Mr. Nguyen. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, everyone. Item F, Doug, you're still up.
Item F is another purchase agreement with a company called bioMérieux. This allows us to essentially provide some of the procalcitonin, varicella, and mumps testing in a cost-effective manner. That's something that we already provide as it is. And this is another Vizient GPO pricing. They're actually going to come in and upgrade our equipment as well too as part of this agreement. So it's $145,000 annually and $580,000 over the 4-year period. It does carry a termination clause after the initial 18 months in order to get this. I'm sorry, it does carry a termination clause after 18 months of the contract. So,
okay. Any questions for Doug? Okay. Entertain a motion on item 5F.
This is Dorothy. Move approval.
Motion by Mr. Bose. Do I hear a second?
Second. DT.
Second by Mr. Nguyen. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? The motion passes. Thank you, everyone. All right, Doug, item G.
This is another amendment to an agreement, but a purchase agreement. One exception to bid and an amendment to an original agreement allows us for Hologic to come in and really add an additional platform, an additional testing platform to a machine we already have in the lab. This specific reagent purchase agreement allows us to run a number of different women's health and STD testing centrally, and it provides a more accurate result for both the community health centers that we have that will be sending to us and for testing here on campus. It does carry a 90-day out with this, but these the reagents are the only reagents that we can purchase for the machine that we have, which is also a Hologic machine, hence the exception to bid there. So any questions on the Hologic agreement?
Any questions for Doug?
I have a quick question. When they asking us for exemption to the bid and all that stuff, do we get some special discount when we do that to help them along the way, or how does that work, you know?
Usually what happens with these is we commit to a minimum purchase per year, and through that commitment, then they do offer volume pricing and discounts for that. But there's not another reagent that we could purchase to run on the Hologic machine other than the Hologic reagent, if that answers your question.
Since we don't go for bidding, is there an option for us to negotiate the most favored nation status type thing, so that if the price that they sell to other facilities is less than us, we will automatically get readjusted?
We can definitely look at that in the contractual terms through maybe one of our GPOs. That's not something that we have on this particular contract, but again, what we try to do in order to save costs is this is not the only reagent that we use for the Hologic platform. So we try to centralize testing as much as possible to reduce our costs per reagent for this platform. So the more volume that we commit to them, the lower that price point comes for all reagents, if that makes sense.
Since I'm not trying to beat up on vendor or anything like that, but to protect, our shareholders, the taxpayer, if we don't know what's out there in the marketplace, perhaps we can start looking to most favored nation status for those that we don't have to go for bidding, just to protect our back end.
Absolutely, and that's something I can work with supply chain. I know there's some new benchmarking tools that we're getting into place as well to do exactly what you're talking about, DT. So that's definitely something that I can continue.
Yes. Thank you.
This is Dorothy, and I hate to keep beating up on a dead horse, but we make exceptions to bid, and then when I look at how they plan on doing any diversity, it's always a closed door. So I'm a little concerned with that we make exception to bid, we give them everything, and on our policy, they don't even attempt except to say, we didn't ask for we can't contract. That has got to, as an organization, if we are going to really look at improving our diversity, we got to get serious with this, okay?
Yeah, I agree with you, Dorothy, and that's not a dead horse. We've got to keep beating that because it's a challenge for us, but we need to keep beating that drum, so to speak.
Okay.
Dorothy, I agree with Steve that I wouldn't ever say that in that regard, that it's an issue we've overemphasized or you keep talking about. It's a concern of all of ours, and I think the staff and me in particular need to direct that. And we shouldn't be led by our vendors. We should lead our vendors. And if they want to do business at JPS, there are certain requirements to do that. And to your example, they don't have the right to shut the door in certain areas and open up the door in other areas. So your point's well taken. I'll make a commitment to work on it.
Thank you.
Yes, ma'am.
Can I make a quick comment on this one? I saw an article the other day, and they said the equity gap to vendor is will take, in the normal course that we go in, will take about 330 years to catch up. But we could make a big dent if every one of the company increased by 1%, we can cut it down to 15 years. So that's something kind of interesting to read from that standpoint. So if we can increase that, we'll do our part. So.
I like it.
I'll send it out to you, Steve, for reading.
Please do. Yeah, I'd like to read that.
Yes, sir.
It was a good article.
So item on the table is item G. Any other questions for Doug on this piece? Hearing none, I'll entertain a motion.
Move for approval along with the exception to the bidding process.
Thank you, DT. Do I hear a second? Do I hear a second by Mr. Bose? All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Thank you, everyone. Thank you, Doug.
Thank you.
Item H, Adam Lane, you're up.
Mr. Chairman, it's Angie Morgan, and I would like to present for Adam today. He had to be on PTO.
We would much rather have you, Angie, than Adam any day of the week and twice on Sunday.
Oh my, thank you for your kindness. Okay, so what I'm asking for today is we are recommending Perkins & Will as the architect for a renovation and addition to our health center for women, which is located at 1201 South Main. This was discussed at Planning Committee several months ago, and the concept was approved to move forward to finance. We budgeted, and we went out for RFQ for an architect. We had 23 responses, and the voting committee on that recommended Perkins & Will, and that's what I'm bringing to you today.
Okay.
So Steve, just a reminder, it's been
Yes,
a while since this was on the planning committee agenda, but just a reminder, this is not a bond program project. This is a JPS capital improvement project. So the procedures and protocols that we follow are what we've historically followed, and there shouldn't be any issues or concerns with that.
Great. Thank you for that, Trent.
Thank you. Thank you.
Any questions for Angie? Okay. I will entertain a motion on item H.
Move approval.
Second.
Motion by Mr. Petty, a second by Mr. Bose. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Motion passes. Thank you. Angie, item I.
Yeah, here I am again. Okay, this one is for, if y'all will recall, we had about $10 million in the budget for infrastructure improvements and deficiencies, and one of those was the chiller for the main hospital. And so this is TDI Industries, which went out for RFP. 5 vendors respond. The voting committee wanted TDI as the best value for JPS to perform the work. The actual chiller itself purchased through our GPO. It's a train chiller. It didn't reach the 500,000 board threshold, and it was on our GPO. So we went ahead and purchased that. TDI would be coming in to hook everything up, and that's what I'm asking for approval today.
So you broke up a little bit there, Angie. What is TDI doing? They're doing the concrete or the infrastructure piece?
They're going to hook everything up, the mechanical, electrical, and plumbing.
Got it. The hookup guys. All right. Any questions for Angie? And this went through planning as well, correct?
Yes, and also finance as far as releasing the funds to get this done. Yes, sir.
Okay. So this is the final approval of the agreement. Okay. Any questions for Angie? Hearing none, we'll entertain a motion on item I.
Move approval.
Motion by Mr. Bose.
Second.
Second by Mr. Nguyen. All in favor of the motion, please say aye. Aye.
Aye.
Thank you.
Opposed? Motion passes. Item J. Angie.
Hi, thank you. This one is for a lease agreement for a warehouse. It's a 5-year lease. You probably know we have a lot of stuff that has to be stored. We've listed it in the executive summary. In the past, I will tell you, our mechanical and electrical rooms were oftentimes used for storage. That's a big joint no-no. We know better. We can't even store a filter in a mechanical room. There are lots of things that need to be stored. We really need this warehouse. We looked at 6 different locations. This one provided the best access. It was the most secure. It was clean, spotless. You could store medical supplies in there with no problem. We did have a committee, a multidisciplinary committee that went and looked at all of these warehouses. And we're just asking today for approval of this. It is in the budget.
Thank you, Angie. Angie, I've got a bunch of old antique motorcycles that my wife is really tired of looking at. Can I have a little corner of this storage unit?
I'm going to have to say no because we're going to fill it up.
Good answer. Is this temperature control, Angie?
I'm sorry, DT.
Is this facility temperature control?
This has heat. It does not have cooling.
Mm-hmm. Would that mess up some of our medical equipment? Or
We won't be storing. Yes, we won't store anything computerized in there. We'll store all that on our temperature controlled warehouse on the main campus.
Okay.
Okay.
Hey, Angie, Trent, do you know what the price per foot came out to on this lease?
About $6 a square foot.
Okay.
Okay. Any other questions for Angie? Hearing none, I'll entertain a motion on item J.
Move approval, Steve.
Second.
Motion by Mr. Petty, second by Mr. Nguyen. All in favor of the motion, please say aye.
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 Opposed?
Thank you.
Motion passes. Thank you, Angie. And again, you're welcome here anytime.
Thank you.
We'll move to item K. Zelia Bama Ball, you're up. What you got for us today?
Good morning, members of the Finance Committee. The next 4 contracts are all for the same program, so I'd like to give a brief overview to the Finance Committee about what these contracts are for. These contracts are for what is called the TCHAT program, and that is funded through Senate Bill 11. If you recall, last fall, we received close to $5 million to fund this grant program. TCHAT stands for Texas Child Health Access through Telemedicine. And we have hired psychiatrists and mid-level providers as well as social workers that will be providing telemedicine to various school districts in Tarrant County, but also this is a regional grant program. And so the other counties that are covered with the grant funding are Clay County, Cook County, Erath, Jack, Montague, Palo Pinto, Parker, Tarrant, and Wise counties. And no district dollars are being utilized to cover these expenses. This is all funded through the grant. And given what we know that is called the 4th pandemic, which is the mental health surge we're now seeing as a result of the COVID-19 pandemic, especially in adolescents, this program could not be more timely, and we are excited to be a part of this. So I'm here today to present to you the first contract for your consideration and approval of an interlocal agreement for the provision of pediatric and adolescent behavioral health services between the Boyd Independent School District and Tarrant County Hospital District under the Senate Bill 11 grant.
Let's give a shout out to all of our friends in Montague County. We still love them.
Is that how you pronounce it, Trent?
Yeah.
Okay, thank you.
Montague sounds good too.
Yeah, the Montague part of it is a little Shakespearean twist to a West Texas county, but we're okay with that. We got to give a little bit of variance to a woman originally from Alabama because they don't have a Montague County in Alabama.
Exactly.
I move approval, Steve.
Steve, you're on mute.
I was testing y'all. Thank you. Passed. Thank you, Zelia. This is fantastic. Really excited about this program and excited that the state is putting some money into this and that we're in the middle of it. So thank you for that. I don't think I have a question. Any questions for Bama Ball? Okay. Hearing none, I entertain a motion on item K.
Just Trent, approve.
Motion by Mr. Petty.
Second.
Second by Mr. Nguyen. All in favor, please say aye. Aye.
Aye.
Opposed? Motion passes. Thank you, Zelia. Item L, same thing, right, Zelia?
Yes, sir. This is an interlocal agreement between Cross Timbers Academy and Tarrant County Hospital District for the TCHAP.
Okay, so entertain a motion on item L.
This is Dorothy, move approval.
Motion by Mr. Bose. Do I hear a second?
Second.
Second by Ms. Arizola. All in favor, please say aye.
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 Opposed? Motion passes. Item M. Zelia?
Again, a consideration of approval for an interlocal agreement between the Gordon Independent School District and the Tarrant County Hospital District under the Senate Bill 11 Mental Health Care Consortium.
Okay. Entertain a motion on item M.
This is Dorothy, move approval.
Motion by Mr. Bose.
Second.
Second by Mr. Petty. All in favor of the motion, please say aye.
Aye.
Opposed? Motion passes. Now, is item N the same or is that different, Zelia?
It is the same. It is with the Fort Worth Independent School District and Tarrant County Hospital District under Senate Bill 11 through the Child Health Mental Health Care Consortium.
Okay, it's just phrased a little differently, so I just wondered if it was the same, but it is the same.
Zelia, let me ask you a question because, I mean, there's obviously a vast number of school districts that could have availed themselves to this. How was it marketed and released, and why such a really odd mixture of recipients on this?
Great question. We do have a manager over the program as well as our Dr. Potawiltz. And so we have reached out to multiple school districts and multiple counties, including Tarrant County. The challenge has been working through the various legal processes with all of the school districts involved. So, for example, we've been working with the Arlington School District for several weeks now. We're hopeful that next month we'll be able to have Arlington to present. But we're taking the largest school districts in each of the counties to start with, and then work our way to other school districts within the counties. We just felt like if we got the biggest in each of the counties first, we get the most opportunity with the greater number of students. And so it's a matter of, this is whole totally new process. And so the school districts have their own legal processes, and then of course we do. And so it's a matter of timeframes because these have to go to the school boards first before we can even present here to this board.
Are we getting help from our communications department and JR and her team to get this publicized and out there? Because it would seem like any district would really appreciate this.
We are, and we will be working with Diana Brodeur as well. But like in Tarrant County, for example, with Fort Worth and then Arlington, those are the two largest school districts in Fort Worth. But of course, there's more school districts in Fort Worth as well that we will be branching into.
So we'll hear more of this probably as different districts are made aware of it.
Absolutely. Next month, I hope to bring it back to you all, Arlington School District.
Great.
So Zelia, when you talk about Fort Worth, that's all of their schools within their system?
Yes, ma'am. It's the entire Fort Worth ISD as well as the entire Arlington ISD.
Oh, okay. All right. Okay. Well, when you start getting all those calls, I hope you have enough staff.
So the beauty,
this is a big project. It really is.
It is huge.
It is a big project. However, the beauty of this is that we're utilizing technology to achieve it. And so all of this is done via telemedicine. And so that's the beauty of it. So you don't have all the travel times and those type of things that could impact your ability to see more people. So having the technology and the video face to face allows the kids to be able to stay at school, not have to leave, and all of those great things. And so it's a big opportunity. We're mirroring this off of what the Dallas Children's Hospital has done in their region as well, and it's very successful.
Great. Well, I'm very happy for it.
Yeah.
Okay.
We are too. Thank you, ma'am.
I have a quick question regarding, I know reference in here something about data collection and HIPAA. There's also reference with the Family Education Rights and Privacy Act. Are we sufficient enough to be able to handle things that are outside of the HIPAA stuff?
So there are special consent forms, DT, that the family of the child has to sign off on if they're under age of consent, as well as the child. The platform we use is HIPAA certified as well. And then the grant covers us hiring an IT data specialist so that we're able to, and we're in the process of hiring that individual as we speak, so that we can manage all of the data to have all of our measures of success covered.
Right. Yeah. My concern is, technology-wise, we can handle HIPAA and FERPA or whatever they call it. But from a process standpoint, with our staff, do they know enough to differentiate the difference between the two to stay in compliance? That's why my question.
Yes, we do, because with the pandemic, we rolled out telemedicine very quickly, and we had to go through the same process for all of our patients as well, adolescents and adults. They had to sign special consents. And so we are very familiar with HIPAA compliance through televideo.
Okay. All right.
Thank you. Any other questions? Well, this is an exciting time, and I just really appreciate your support because we're going to help a lot of kids.
Agreed. So I'll entertain a motion on item N.
So moved.
Second.
Motion by Mr. Petty, a second by Mr. Nguyen. All in favor of the motion, please say aye. Aye. Opposed? Motion passes. Thank you, everyone. Thank you, Zoe. That's awesome. We're very excited about that.
Thank you all.
Oh, one quick follow-up, please. On that, I know we have insurance cover under HIPAA. Do we have insurance cover under the FERPA? FERPA, whatever they call it?
FERPA.
I am not sure about that, DT. I would assume so, but I don't want to make an assumption. I can follow up with you and get that information back to you.
If you don't mind, I think we should revisit that with the part of the insurance and compliance to make sure that we cover on that one also as well. Thank you.
I will be happy to, DT. Thank you.
Okay. Item 6, executive session. Ms. Walker, Mr. Early, do we have anything for executive session?
No, sir, not that I'm aware of. I'll let Daphne make sure that legally we don't have anything, but I did want to make mention that I got a phone call from the county judge at Montague County, and they've got a bed and breakfast ready for you, Trent, for the weekend, free of charge.
I'm gonna have to go there now.
Just in time.
It's a beautiful place. They got a replica of the Globe Theater, and they do a lot of Shakespeare on the weekends. So it's a wonderful place. You'll love it.
Go during peach season. It's coming up in about 3 weeks.
That's true. That is true. Peach season works. No, Daphne, and correct me if I'm wrong, but legally, I don't think we have anything. I think that you have had such a well-run committee meeting, Mr. Chairman, and it hurts me to say that I don't think you have anything to discuss in closed.
Okay.
Items for closed session.
Steve, this is Chuck.
Yes.
Stewart. Can you hear me?
We can.
I've been listening the whole meeting. I have not been able to get on the video side. Well done, I would say.
Well, thank you.
Thank you, Chuck. Appreciate it. Sharon and Steve put together good agenda, and Daphne makes sure they do it all right. So thank you very, very much.
I just do what they tell me. Okay, if there's no further business to come before the committee, we are adjourned. And stay tuned for noon for the
Okay, all right, okay. HR committee.
We are adjourned.
Good afternoon, everyone, and thank you for taking the time out to attend the Human Resource Committee meeting. So I would like to go ahead and call it to order at this time. Do we have any citizens wishing to speak?
I'm not aware that we have any.
We do not have anyone. Thank you. Okay, our next on the agenda is approval of the minutes. You've had an opportunity to review it. Are there any corrections? If there are no corrections, I will entertain a motion for approval.
Approved.
Second.
Okay, I heard the, Amanda, that was you for the motion, right?
Correct.
Okay, and DT was second, okay.
Yes,
All
ma'am.
right, all those in favor signify by saying aye.
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 And opposed by nay. Okay, well, thank you. And so we'll just continue with our agenda. And next we have Alex, who is going to review the human resource dashboards, okay?
Great. Thank you, Mr. Bowles. And please, if you could, Jeffrey, display my HR dashboard document. Thank you. And you can move to the next slide. And the next. Thank you. That's perfect. Thank you very much. Good afternoon. This is a familiar document to many. It's the HR turnover dashboard. And I will call your attention in the top right-hand corner to a few data points to discuss. One is the total vacancies, hovering at about 558 today. I believe that the vacancies are higher for a few reasons. One is there's certainly been a move by some talent in the market away from healthcare. No real surprise there in light of the year plus that we've had. And I also think there is some movement as some workers look at work from home opportunities in the marketplace. And as many of you on the board may know, that work from home has been an evolving factor in business since the pandemic, and is continues to be a point of concern for some industries more than others, and some businesses more than others. The other data point I will have you take a look at is our involuntary turnover has remained relatively steady. There has been an increase to the voluntary turnover. Again, no real surprise in light of the past year plus that we've had. Total turnover across the organization is also up, very much like our competitors in the marketplace within healthcare. And of course, less than 1 year turnover really reached its peak last quarter during the pandemic. And it's starting to come down. I think it will recover. I think we will see it continue to drop as we move to Q3 and Q4. I'm crossing my fingers when I say that, because who knows what the pandemic might do. But we are working diligently on a couple of areas related to first year turnover. And I would like to take a deeper dive into that. If you could go to the next slide, please, Jeff. These are two areas that HR looked at as it relates to first year turnover. There are really two areas of concentration that drive our high numbers there. One is nutritional services, and the other is the patient safety assistance. That's the new term for sitters. So the nutritional services, when you look at the baseline all the way to the right in the top box, when we started this pilot program several months ago, and I mentioned it to the board, I believe a couple of meetings ago, that we had started this pilot, and I would come back and report out to you on our progress, good or bad. Well, I'm happy to say that it's good news. We started with a baseline of 50% turnover, first year turnover in nutritional services. We have gotten that down to 33%, approximately 33%. For patient safety assistance, the box below nutritional services, we had an even higher baseline of turnover for first year at 56%. It has seen a dramatic decrease to just over 12%. What's important about the decrease is the action be taken and how we believe the action be taken can be leveraged across other departments, right? Not only nutritional services and patient safety assistance. So HR has really taken an all hands-on approach with these two departments. We've started having, crucial conversations for leaders, 5 functions of team leaders. All of these are different courses. We've encouraged leaders on how to work better with very different personalities, people that have come from different cultures. There was a slight but consistent pattern of employees resigning in their first week of employment in nutritional services. And what we were hearing when we interviewed these individuals was that this was not the job we were expecting. Well, I have to say that Neil Lavender and his team have really responded well to this data. In partnering with HR, we began a new best practice to make sure that we're touching each new hire in that first week, in the first 30 days, in the first 90 days. We've even looked at the applicant process to ensure the role is being clearly explained before the offer is accepted. And actually, Neil even went an additional step, and that is he realigned his leadership team and increased one of the a manager position so that he would have 2 managers, one that could focus a great deal of time on training the employees to ensure they were trained properly, while others focused more on patient meal services and et cetera. But what this new management structure really helps to do, increasing it with 2 team leads and a manager, is it also provides a promotional path for individuals who join the nutritional services team who want to grow within nutritional services or who want to grow within JPS. So real proud of Neil and his team for working with us on this, and proud of the HR team for not working in silos, but really coming together across all of HR functions to ensure that we're supporting them in the way they need to be supported. Lastly, just a few specifics on the patient safety and driving down that high turnover. We obviously designed a new project team across HR. We are partnering with patient safety assistants and their leaders to really drill down on where their dissatisfaction, or how can we create a more satisfying environment for them, a work environment. We're analyzing all the turnover, involuntary and voluntary resignations through exit interview data, and really scrubbing that data to then be able to provide a better culture for their work, a better opportunity for them to grow in their positions. So we're really looking at things. We're not as far along as we are with nutritional services, but we're really in the analysis stage right now, collecting more qualitative data. And I hope on our next report out that we've got that 12% down to 8% or 7%. I hope that we've got the nutritional services down from 33 even lower. So 2 projects that I just wanted to report out, rather than just giving you turnover data. I wanted to let you and the board understand what we're doing proactively to help solve for some of those issues. Next slide, please. This is a strategic recruitment dashboard. Just a couple of metrics that I wanted to bring to the board's attention. One is our internal recruitment rate. And just in case that's a term that some are not familiar with, the internal recruitment rate is really the total number of candidates hired from inside the organization. So this is all about internal mobility, right? So in order for it to count in this category, a requisition must be filled by an employee and recognized as a hire, right? So this doesn't include any agency hires. This is all our internal employees today working on campus. And those employees, why that's so important to us is because at the end of the day, internal mobility really encourages loyalty and career progression. And so many of the employees who service this network, they're looking for opportunities to grow. They're looking for opportunities to increase their status, expand their abilities. And so we really looked at this metric as an important one. Fell off a little bit in Q2. I think that's largely due to the number of individuals we had to bring in on a contract basis. But I think you will see in Q3 and Q4 that will come right back up to normal levels. Lastly, you'll notice the external hires, time to accept. So that's really a days to hire metric that we keep track of. And it's important for us because when you're out in the market looking for talent, our talent acquisition team works very hard. Every time you come to the marketplace, it's like a balance sheet for a company. It's a snapshot in time. It's constantly changing and evolving. And so it's really important for us to be able to source high quality candidates who want to come to JPS for the right reasons, who embody the 3 rules: seek joy, own it, and don't be a jerk. It's important for us to quickly get to these individuals, make sure that the candidate experience is high, make sure that we keep the time short between touching the candidate and hiring the candidate. And so we really watch this metric closely. We don't want it to creep up beyond 45 days. I'd like to see it lower, but we never want to jeopardize speed for quality, right? So somewhere in that 40 to 45 day range seems to be where we can balance both quality and speed to market. The last page, if you could go to the next slide, please, it's really just an achievements. Every time I come before you, I want to give you some data. I want to talk about what we're doing well, where can we improve, but I also want to just share an achievement with you. And every meeting, I'm going to pick a different department within HR to share some of those achievements. Today, it's our learning and development group, headed by Shane McKee, who's doing a fantastic job. And what I have here is just to give you the number of participants that participated in leadership and professional development courses in Q1 of FY21. And then you'll notice in yellow, the number that participated in Q2. Well, if you look at those numbers, you'll see that we more than doubled for leadership development from Q1 to Q2. And we more than doubled for participation in professional development courses between Q1 and Q2. I'm really excited about that. And I think it shows that, Mr. Rulli always talks about we can't blame COVID, and he's right. And in that regard, we're looking at COVID and we're staring it right in the eye and we're saying, we're going to get our people the tools they need to be successful. They want instructional training, they want development, and we're going to get it to them no matter what. And so we've been able to double the amount of participation from Q1 to Q2. I'm very proud of that. On the right-hand side of that are a number of courses that were these participants took as part of their learning and development. And as you'll see, some are on emotional intelligence, unconscious bias, effective coaching, training for leadership, etc. So just wanted to share that good news that things are, coming back to normal slowly. And we've got a good team of folks that are concerned about the right things, and that is always developing our people and trying to make their culture of work the best it can be. And that concludes my presentation, Mr. Voss.
All right. Do anyone have any questions?
I do. I just have a quick question. Hi, Al. Hey, Alex.
Miss Arizola.
Just in your achievements listing on this last sheet, I know that last year, or probably the year before, we had a breakdown of which directors and percentage of directors, managers, and executive staff participated in leadership development. For our next HR meeting, if you can share that, because we know there was a concern that there was a lower number of executive leadership not participating in the development portion.
Awesome. I will make sure and make that a part of it and get back to you on that and the full board. Thank you. Great.
Any other questions? Okay. Well, Chuck, it's nice to see you. I didn't have anything, but thanks, Alex, for bringing that report. I do appreciate you going into detail and bringing us the information a little bit more in depth. Thank you again. Okay.
Thank you, Mr. Doss.
All right. If there are no other questions for Alex, then let's just move into our policy. And this time I thought I would go through them because when I looked at it, I thought it was a lot of changes, but I don't think it is. So what I will do is just ask Rihanna to come up and to introduce the policy, and then we'll just approve each one individual. Okay? You ready, Rihanna?
Yes, thank you, Ms. Du Bois. So we're HR 1301 is as the first policy up for consideration. 1300 and 1300, the only line that actually changed was the final line of the statement that says the policy describes the expectations and procedures for drug and alcohol testing, along with outlining opportunities with EAP. So we added this addition about EAP. The other changes are just adding an S to team members and also switching out JPS for the district. So no real strong substantive changes other than adding in a reference to EAP as a part of our process.
All right, thank you. Any questions for Rihanna? Okay, then I entertain a motion for approval of 1300 drug and alcohol-free workplace policy.
Okay.
DT, were you saying something? Okay, DT. All right.
Second. All
right. Okay. All right. Thank you. It's been moved by DT, second by Dr. Potterwich. All those in favor signify by saying aye.
Aye.
Aye. All right. All those opposed by nay. Policy approved. All right. Then we'll go to HR, Human Resource 2600 employee standards. Okay. That was the one that had looked like a lot of changes. Okay.
Okay, I can speak to that. So on HR 2600, this was a policy that has been around for a number of years. What we did was we took a substantial part of the policy and put it into a procedure. There was no procedure for HR 2600. So what we did was move over everything after the intent and scope into the procedure. So we didn't lose as much information as I think was anticipated. It's just that it moved over into the procedure, which is, of course, background reference for the board, but that's what happened there.
All right, thank you. Are any questions on the policy for Rihanna?
I have a quick question, and I'm not sure it's appropriate with this one or not, but it's more around some of the recent law changes with the First Step Act and the Second Chance Act, and how does that apply within healthcare? And we know there's a certain restriction with CMS and all that stuff regarding to criminal act and all that stuff, but I think it may be worth looking at it to see if we can expand to make sure that those that qualify for the Second Step Act, and if it's appropriate, may have a chance to apply and work here also as well.
DT, what are you talking about?
It has to do with First Step Act and the Second Chance Act.
I think you're referring to hiring practices. Is that what you're referring to on the application and the way that we entertain applications? Maybe I'm just asking.
Yes, and then it's also intertwined with how we operate as a system itself, right? With some of that stuff.
And I can speak to that a little bit. I do know about our application process. And we do ask people to check the box if they've had felonies or convictions. However, that doesn't automatically eliminate the employee, the potential employee. It's just a part of the background screening. If somebody's dishonest about it, that's more likely to eliminate them, an outright elimination, than if they have something on their track record that's disparaging. In addition, we don't ask for people to disclose if they were arrested, which is one of the factors that has been criticized the most in hiring practices.
Mm-hmm. But I just want to make sure that they're not being discriminated against from behind, as far as behind the scene type thing also as well.
No.
I'm not sure we're ready for that yet, but I just want to make sure that,
They are definitely not being discriminated against.
because it does apply a lot to minority and all that stuff. So just the other place, I'm not sure if you guys are familiar with the Office of the Assistant Secretary for Planning and Evaluation, ASPE. That may be a good source of information to look into, to update us with that rules. Mm-hmm.
Yes, I saw this.
Right.
Yeah,
Thank you.
They're giving us 20.
Well, DT, I thank you for that.
Yeah,
And I think that might be just one of your,
Are we
Alex, that just might
sending
be one of
people there
your
if they're not
quality indicators
gonna
that you would
deal
just
with their
monitor and report back on.
hotel and stuff? But we've got free tickets.
Robert, you're not on mute.
Whispering.
Robert, you got the mute, buddy.
It's no longer a personal conversation. No, I'm just kidding.
Okay.
Sorry, I was clicked on mute and not talking. And I think DT, first of all, I need to ask you, DT, is there a family member of yours that heads up that agency? Because you have a lot of family members in federal government. I just need to check when I make my phone call to that agency. Am I going to be talking to a Win or somebody else?
No conflict of interest on me on that one.
Wow, let's count that as conflict of interest number one. You don't have any. That's cool.
But their offices are in Montague County, just FYI.
DT, I am not familiar with that office and I have never worked with that office. So I would be happy on behalf of JPS to reach out to that office and see if they can give us some best practices and think through some of that stuff. I'll be happy to. If you do have a contact in that office, let me know. If you don't, I will make a cold call to them and I have no problems doing that.
I don't. I just want to just bounce some ideas so that, as the law become effective, we just want to make sure that are we ready or how far are we out so that we can embrace a certain type of offensive that they already paid their price to come back to society. Yeah. Mm-hmm.
I totally agree. And I think there's always a balance. And we talked about this yesterday, as a matter of fact. Dr. Duncan and I and Daphne were talking about what we do when we, bring people into the workforce and what kind of checks do we provide them? What do we do? What's that balance? Because we don't want to be headlines because we brought people back in that we didn't vet properly. And we want to give everybody fair chances because that's kind of our organization. So DT, I will follow back up on that. And Rihanna and I will probably communicate back to you in the HR committee how those conversations have gone. I appreciate it.
I think most of it is more around, youthful mistake that they made for drug use, but not a drug dealer type thing. So it's one of those that, people are not the same anymore when 10, 20, 15, 20 years had passed. And that may, but not the other criminal stuff. I mean,
no, I understand. Rihanna and I will follow back up and we will move forward on that. Thank you, DT.
All right. Thanks, DT. Do you have anything else?
No, ma'am.
Okay. All right. Do anyone else have any questions or comments on the 2600 employee standard policy? Okay. There being no other questions, I will entertain a motion for approval.
Move for approval.
Okay, DT.
Second.
All right. Move for approval by DT, second by Trent. All those in favor signify by saying aye.
Aye.
Any opposals by nay. Okay. policy is approved, okay? Then next is 5600. Rihanna?
Okay. Yes, HR 5600. Once again, there are no changes to 5600, no substantive changes.
Okay. There are no changes on the remainders 4, unless somebody have a question on them. Can we just read them, Daphne, and get them approved as one?
Yes, if nobody has any questions, I think the board received all of these in their portal for review. These are just coming up for their triennial review. And if there's no questions and Rihanna doesn't have any substantive comments to present, then you can just seek approval from the committee.
Okay. Did anyone have any questions on any of the remaining policies? For your employee identification badge, that's the only one that you kept definitions in. Was that supposed to be moved to procedures, or that was intended to leave that so that we would know the general information? That's the only one that has more than the rest of them. Is that deliberate?
That also is an older policy. So it's a district policy. There is no procedure. It is kind of an unusual policy in that it doesn't have a procedure yet. We may add a procedure at some point and make it consistent with the other. But at this point, we're just leaving it as one whole procedure.
Okay. Did anyone else have any questions on any of the other policies?
Dorothy, I do have a question.
Yeah.
The hospital district does employ physicians, not correct?
I can't hear you, Chuck. Speak up. Okay, gang, I couldn't hear.
No, it's not you, Dorothy. It's Chuck. Chuck, your system today is really hard to hear. So I'm not sure if you want to email us a question or maybe try it again.
I was mentoring him on speaking in how to speak publicly.
Chuck's gone to the DT Win School, not being able to hear you. Well, I think what we've done is caused Chuck to just go away.
He's frozen. He's frozen. Okay.
We have a change though for this policy.
Yeah, Chuck, you're not coming across for some reason. Your audio isn't working and you are frozen in time. So,
That's okay.
Well, here's what we can do, Dr. Weber, is if you will just text or email me, we can get that question answered for you, and we'll certainly put it in the board minutes as to what your question was, because you are audio compromised right now.
Yeah. Well, maybe we can just go through one by one, and the one that he's got a question, he can hold his hand up and we can know that's the one that he needs some questions on. How about that? Would that work for you, Chuck?
Yes.
Okay, so if we just go ahead and I'm going to read off the ones, I think we're at 5600. Is that the one we are at now? It's 5600. There is no questions on that one. That's 5600 is the motion policy statement. 6200 is promotion policy statement. 1700 is the resolution policy. Okay, and 2000 is employee identification. Is that the one, Chuck? Okay, so can we just go ahead and approve those, and that won't leave us but one now? Okay, that's the one he's talking about. It's okay. the 2000 one. Is that it? Chuck, is the 2000 employee identification? Yeah. Okay, so let's just approve the others, and then we can come back to that one. And maybe you can get your question in the chat room, and I can see it. Okay.
Yes.
Okay. All right. So for all of the policies for 5,600, 6,200, 1,700, and for 7,000 staff and effectiveness. Can I get a motion to approve those?
If I want to just clarify something, if that's okay, we're asking to archive 700 is what we're doing.
Okay, all right. Archiving 700. Okay, thank you.
Yes.
All right. With that correction, can I get a motion for approval?
We on the 17th, no, never mind. The archive have Bill Whitman on there, but we can archive it, so never mind. Sorry. Move approval.
Is that a motion, DT?
No, ma'am. Move approval.
Okay.
Second, Potter Wiltz.
Okay, all right. It's been moved by DT, second by Potteridge. All those in favor for approving and archiving that one policy signify by saying aye.
Aye.
Any opposed by nay? Okay. All right. Did we get Chuck's question yet?
No, I think he's saying move on. He's shaking his head. So
Okay.
I think he's good.
Okay, all right. Then we just need approval for 2,000 employee identification policy. All those, can I get a motion for that?
Move approval.
Okay, DT. And Chuck is seconding with his thumb up. All those in favor signify by saying aye.
Aye.
And those opposed by nay. All right, we got through that. Okay. Thanks, Chuck. Robert, did you have anything for closed session?
No, ma'am. I don't believe we have anything for closed session, and I think we are good. And I think, Madam Chair, you have the right when we come to full board meeting to brag about how efficient your meeting was today.
Well, you know I'm gonna have to tweak Steve Montgomery since he's not on the.
That's exactly right.
Okay, there being no further business, I will entertain a motion for adjournment. Okay, Chuck got it. All right, gang. Then the meeting is adjourned. I can't see the time. We really did